everybody, it's Ryan here, board certified specialist physician, and this is our 41st practical approach in internal medicine. A warm welcome and thank you for joining me. If you haven't yet subscribed to my channel, I strongly encourage you to consider that. Today, we're talking about a very broad topic, leukocytosis. Some humor as always. My boss said, I find it highly suspicious that you are only sick on weekdays. I said, it must be my weekend immune system. Okay, guys. Increased leukocytes. Leukocytes, as we know, are white blood cells, and the way we stratify this is granulocytes versus agranulocytes. So it makes sense then to do a differential on your white cell and look for which population of white cells are preferentially increased. So is it your granulocytes, which is your neutrophils, eosinophils, or basophils? Is it lymphocytosis, or is it an acute leukemia? Right. So let's start off with granulocytes. Okay. So if it's a neutrophilia, most commonly it's reactive or neoplastic, but most commonly reactive in terms of an infection somewhere. All right. Basophilia, not very common, right? And if you see basophilia on the diff, you're thinking infection, could be allergies, chronic inflammation, or chronic myelogenous leukemia. If you see eosinophilia, you think about helminthic infections and hypersensitivity problems. So parasitic infections, and the whole host of parasitic infections we get. Okay. Allergies, autoimmune issues like eosinophilic granulomatosis with polyangiitis, previously called Churg-Strauss syndrome, inflammatory bowel disease, rheumatoid arthritis, sarcoidosis. It could be chronic myelogenous leukemia. It could be the so-called hypereosinophilic syndrome or the infamous DRESS, which is drug reactivity with eosinophilia and skin issues. And that usually is life-threatening because life-threatening reaction to a drug. Now, lymphocytosis can largely be reactive or neoplastic. Acute leukes, now the clue to the leukemia is that you got a white cell count which is very high, or sometimes a white cell count which is very low because the marrow becomes infiltrated. But if you do a peripheral smear, you will see blast cells, okay, which are really, really immature forms of white blood cells. You may see anemia and thrombocytopenia because the bone marrow is infiltrated and cannot produce these other cell lines. And we'll speak more about acute lymphoblastic leukemia and acute myelodysplastic leukemia. What is a seller for acute myelodysplastic leukemia is seeing our rods on the smear. Okay, this is taken from MedComic, some beautiful comical cartoon summaries of the four main leukemias that we look at. So acute lymphoblastic leukemia, I want you guys to think pediatrics. This is the most common pediatric cancer, okay? These patients complain, or these kids complain of severe bone pain because of bone marrow infiltration by lymphoblasts, right? These patients bleed, they're prone to infections, so immunoparesis, lymphadenopathy, and fever. It's a clonal proliferation of neoplastic immature lymphoid cells versus acute myelogenous leukemia, which actually, if you think about this cartoon, AML, like the amazing lure, that's the name of this boat. And you got these two older folks here telling us that typically AML affects the older generation above the age of 65 years. They are fishing, and the fishing rod has cracked, and this guy saying, "Our rods stink." uh, which shows us that our rods is a characteristic feature of AML. Classically, you have more than 20% blast in the bone marrow, and the guy is saying, "Blast! His our rod has broken." It's a malignancy involving the myeloid, not the lymphoid, the myeloid line of precursor cells. Often these patients have leukostasis, CNS symptom, disseminated intravascular coagulation. Chronic lymphocytic leukemia also tends to affect the older folks above 65 years of age. Typically, these patients have lymphadenopathy, hepatosplenomegaly, and they can undergo a Richter transformation. Like, when you have an earthquake, we talk about the Richter scale. But here we're talking about Richter transformation in that CLL can undergo Richters and become AML or ALL. One of those weird things. You're thinking about CLL becoming AML? Yeah, that happens. Called the Richter transformation. Okay, it's a clonal malignancy of the B lymphocytes, and it's typically most common type of leukemia in the West. Okay? And then last but not least is the so-called internists leukemia, chronic myelogenous leukemia. Okay? Very important to know the Philadelphia chromosome, which is a translocation between chromosome 9 and chromosome 22, called the BCR-ABL translocation, called the Philadelphia chromosome. It's a tyrosine kinase produced by this BCR-ABL gene, which is responsible for the myeloid proliferation. Okay? And that's it. Okay, so practically now, if a patient comes in with leukocytosis, couple of branch points. Are there blast cells on the smear, which is more than 20%, thinking about an acute leuk? If it's neutrophilia, it could be reactive, like an infection or a primary CML. Lymphocytosis, you ask, is a reactive cause apparent? Yes, look for a clinical diagnosis. If no, test for clonality. Okay, probably want to do your flow cytometry and that, and you work it up appropriately. If it's clonal or not clonal, if it's not clonal, work up for an occult reactive disease. If it is clonal, you're thinking about hematological disorder, flow cytometry, bone marrow, and so forth. Okay, if you're dealing with eosinophilia or a reactive cause of lymphocytosis, these are the possibilities. Allergic disease, vasculitis, eosinophilic GPA, we spoke about, parasites, drugs, and more drugs, adrenal insufficiency. If it's a leukoerythroblastic picture, this means if you do a smear, you see a picture of kind of white cells, which are blasts, so immature white cells together with immature red cells. Okay. When you're thinking about something infiltrating the bone marrow, it could be reactive in terms of blood loss or infection or infiltration, like METs, myelofibrosis, or TB. So myelofibrosis tends to happen in the older folks. Okay, my friends, we're still talking about the theme of forgiveness from scripture. Here, looking at the book of Luke. Here, Jesus says, do not judge and you will not be judged. Do not condemn and you will not be condemned. Forgive and you will be forgiven. Give and it will be given to you. A good measure, pressed down, shaken together, running over, will be poured into your lap. For the measure you use, it will be measured back to you. So we shouldn't be quick to judge others. The Bible also tells us when Jesus said, do not look to remove the speck in your brother's eye when there is a log in your own eye. To judge others, you should always have introspection and look within, right? And I pray that this would be the cry of our hearts. Never to judge others, but to judge ourselves. Here are my references. I'll see you soon. God bless.